This video story is about a patient visiting a TCM doctor. The patient shared her observation of the TCM doctor's diagnosis and treatment, and also shared her learning from the process. TCM stands for Traditional Chinese Medicine. A 50 years plus female decided to see a TCM doctor. She has learned the ancient wisdom, Yellow Emperor's Inner Classic, with practices for a few years. 3,000 years of Yellow Emperor Inner Classic is the foundation to TCM. She presented her problem to the TCM doctor that she has problems sleeping for around 5 years. The doctor took her pulse and concluded her liver qi blood deficiency. The patient understood the significance and importance of the qi blood concept from attending the video courses on the ancient wisdom. The patient learned from the ancient wisdom that it is important for a good TCM doctor to conduct look, hear, ask, and take pulse for complete diagnosis. In Chinese, it is called 望闻问切. She decided to offer more related information since the doctor did not specifically ask for them. The patient said her period is normal, indicating liver functionality may not be severely out of balance. She had bipolar disorder for many years. She is having her second round of bipolar, but less severe than the first round a few years ago. Currently, she is in manic stage with a lot of energy to do many things, but could not sleep at night or make doze off during daytime if no interesting activities. As per patient understanding from the ancient wisdom, in the manic stage there is excessive qi blood ascending, creating chaotic mind and behavior. The TCM doctor did not make any remark regarding excessive qi blood, and her diagnosis is still liver qi blood deficiency. The above also implies qi descending ability is affected, which is the lung functionality. The TCM doctor maintains the liver qi blood deficiency as a key problem. In the case of depression, the implication is qi blood ascending ability is poor, opposite to the manic situation. However, it seems the TCM doctor does not consider the importance of qi ascending and qi descending as important. Furthermore, the patient says she has problems sleeping between around 2 a.m. till morning. As per understanding of the ancient wisdom, the lungs functionality organ clock time is 3 a.m. to 5 a.m., implying some out of balance of lungs function. The TCM doctor considered the source of the problem is liver qi blood deficiency, not lung functionality issue. Only in the process of offering more information on the part of the patient, the TCM doctor requested to see the patient pan 2 times and then confirmed spleen deficiency. In the discussion, the TCM doctor asked any blood stasis problem, but did not request to see the underneath of the tongue. The doctor explained, as for 5-element theory, all organs' functionality affect each other, but in this particular case, it is still liver functionality out of balance as the source of the problem. In the previous experience by the same patient with another TCM doctor, the doctor then insisted it was spleen functionality out of balance as the source of the problem. So we have 2 different doctors having different diagnoses. The patient decided to let the TCM doctor to proceed with the treatments. The current TCM doctor carried out 1 hour plus acupuncture at the patient's back, mainly at bladder meridian, with key focus on liver-associated acupoint, 刚腧穴 BL18. This diagram shows acupoint 刚腧穴 BL18 at the bladder meridian. Please see the big horizontal arrow. Several needles were also placed around the back of the neck. See the black box. In general, Gansu Xie BL18 function include treating gastrointestinal problem, skin thickening, blood stasis, insomnia, ease qi blood flow of the liver, improve vision, ease pain. Acupuncture was also applied at Sangyin Jiao SP6 at spleen meridian. Capping was also applied at the end of acupuncture. The TCM doctor recommended self-prepared daily herbs drink as per the list shown, mainly with common food easily available at the supermarket. Example, red dates, white fungus, etc. The herbs drink is meant to strengthen the spleen and calm the mind. The TCM doctor gave many good advice on life cultivation. Example, what food to avoid, like no fried food. Sequence in taking bath with wetting the hair as last step. And she encourages patients to do more qi exercise and self-massaging and moxibustion at a few recommended acupoints. And more exposure to sunlight, especially at the back, due to our modern living with long hours in the air conditioning room. The patient is grateful the doctor spent time patiently giving the advice. This further gives confidence to the patient to her routine daily life cultivation practices. In the prescription, the TCM doctor listed the following symptoms. There is depression, pale complexion, 5 years of sleep problem. And 3 types of herb medication were made. In Chinese, these are called 逍遥散, 酸枣仁, 六君子. These are standard and classic prescriptions since ancient time. Since the patient has some understanding on the ancient wisdom, she can appreciate the helpfulness of the herbs. That is, 逍遥散 is for ease liver qi flow, remove qi stagnation, nourish blood, improve spleen. 酸枣仁 improve heart, liver consciousness, stop sweating, nourish yin. 六君子 improve qi and spleen, remove dampness and flame. A follow-up to the TCM doctor will be made in 1 week time. With some understanding about the ancient wisdom from the video courses, the patient gained further reinforced learning from this visit to the TCM doctor. The patient witnessed 2 different TCM doctors propose different emphasis on the root of the problem. The first TCM doctor a few years back emphasized the spleen functionality as the root problem. The present TCM doctor emphasized liver qi blood deficiency as the root cause. The patient understands the 5-element theory, that is, all organ functionality affect each other. The patient is determined to continue to practice her own life cultivation every day to balance all the critical organ functionality, not just spleen and or liver. The ancient wisdom say 30% depend on medical treatment, but more importantly, 70% depend on online cultivation practice by the patient. Even with the best TCM doctor, if one does not carry out daily online cultivation, example on food therapy, qi exercises, balancing emotion and personality, no complete healing can take place. Even though the TCM doctor did not explain further about qi blood ascending during many stages, and not so much liver qi blood deficiency, the patient understands from the ancient wisdom video that kidneys are responsible for willpower and enormous strength in performance. In Chinese, it is called 肾为做强之官. The patient will focus on balancing the kidney functionality in her daily life cultivation practice. The patient knows her own body constituent is more of qi stagnation, and liver functionality are responsible for it. The patient is also grateful that the TCM doctor treats her liver functionality with acupuncture and herbs. The patient asks the TCM doctor what can cause liver qi blood deficiency. The doctor gave a general answer, that is, there can be a lot of factors, example, stress, emotion, work habit, etc. The patient remembers ancient wisdom also say spleen is in charge of generating qi blood. In Chinese, it is 脾为后天之本，气血生化之源. And ancient wisdom also say spleen is in charge of thinking. The patient knows that her disorganized thinking pattern may be one of the reasons that cause qi blood deficiency, and she needs to practice to improve on more organized thinking. Such practice cannot be achieved by herbs and acupuncture only. The patient accepts the fact that not all TCM doctors will deal on psychological and consciousness aspect. The patient is grateful to the TCM doctor for giving good advice with patience. Example, the kind advice, more than 1 hour acupuncture service with tapping, thereby raising the patient's confidence in practicing more herself the ancient wisdom. The patient is glad that she learned the ancient wisdom from the video with daily constant practices. Now she knows how to seek good TCM doctor who can complement her life cultivation practices that will one day cure her bipolar disorder problem completely. There are 6 essential courses on Yellow Emperor's Inner Classic covering the concept, theory, and practices. This one is Food Therapy for the Unique You with your body constituents, meridians, qi exercises, and other self-help healing methods. Organs functionality, what Western medicine does not know. 5-element theory, build relationship of parts for holism. Qi, its mystery unfolded. 5 essential human life variables. Philosophy, yin-yang theory, and application. The 6 essential video courses on the theories and concept of Yellow Emperor's Inner Classic are being applied to today's modern living, with the following video courses which are shown one by one here. Simplicity and practicality of ancient wisdom on health. Health from head to toe, breast and breast cancer. Health from head to toe, brain, Parkinson, dementia, stroke. A single window to personality, emotion, physiology. Autism, from understanding to solution action. You can find the links to these video courses at my blog www.360q.com.